Check the victim for consciousness, gently tap their shoulder and shout.
Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over into their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20.
Cardiopulmonary resuscitation or CPR can save a life in a cardiac or breathing emergency. CPR is a life-saving method that can be used in a variety of situations where someone's breathing or heartbeat has stopped.
How do you elicit responsiveness in an adult? First, check for responsiveness. Shake or tap the person gently. See if the person moves or make a noise. Shout, "Are you okay?" Second, call 911 if there is no response. Shout for help or send someone to call 911. Third, carefully place the person on their back. If there is a chance the person has a spinal injury, two people should move the person to prevent the head and neck from twisting.
How do we elicit responsiveness in an infant or a child? So for number one is to check for responsiveness. Shake or tap the infant gently. See if the infant moves or makes a noise. Shout, "Are you okay?" If there is no response, shout for help. Send someone to call 911. Do not leave the infant yourself to call 911 until you have performed CPR for about 2 minutes. Carefully place the infant on their back. If there is a chance the infant has a spinal injury, two people should move the infant to prevent the head and neck from twisting.
Fainting is usually caused by the changes in circulatory and nervous system that cause a drop in the amount of blood, sugar, or oxygen that reaches the brain. So if the person is not breathing, start CPR. And when the person wakes up spontaneously or with help, you must call 911 or your local emergency number, and also allow them to rest rather than sitting up or getting up immediately. If they are diabetic and they have missed a meal, giving them a hard candy or sweet to suck on will help raise their blood sugar levels. Make sure the person who has fainted isn't jerking or having unusual muscle spasms as this can indicate fainting.
So what to do when a person did not regain his consciousness despite of help or simulation? You have to open their airways and check their breathing, and then you have to prepare to help them or to treat them. What are the CPR steps? First, push hard and push fast. Place your hands one on top of the other in the middle of the chest. Use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate of at least 100 compressions per minute. Second, deliver rescue breaths. Pinch the nose shut and press your mouth over the person's mouth to make a complete seal with the person's head inclined, back slightly, and chin elevated. To make the person's chest rise, blow into their mouth. Continue compressions after 2 rescue breaths have given. Take note that end the cycles if the scene becomes unsafe or you cannot continue performing CPR due to exhaustion.
If someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when it started and how long it lasts. Protect their head by placing something soft underneath or around it. Once the seizure has stopped, open the airway and check their breathing. If they're breathing, put them in the recovery position. If they stop breathing at any point, prepare to date someone who is unresponsiveness. Call 911 if the seizure is unknown, it takes longer than 5 minutes, and it's already repeated.
First aid is important for a number of situations that don't require a trip to the hospital or to an emergency room. This situation includes minor falls, bee stings, burns, allergic reaction, and other common accidents. A first aid kit is helpful for these types of situation. After completing our basic life support video demonstration, we have learned that many things that I or we could put to use if we ever encounter a situation involving life or death. This valuable knowledge could help us to save life and cope with an emergency. It could be a matter of keeping a person breathing and reducing pain. You may be able to keep a person breathing, reduce their pain, or minimize the circumstances of an injury or sudden illness until the emergency medical arrives.